From beautiful West Hollywood, it's My WeHo World. Welcome. Tonight we have a really important show. It's on healthcare, the law, and medicine, and I have a doctor and a lawyer with us. All I need is a furrier. Heather McKeon, welcome back to the show.
Thank you.
This is your third time on?
Yes.
Yeah, this is your third time on. Yeah. You did it live with me.
I did.
Yeah, that's quite an... And Dr. Phillip, Musikanth, what is the name?
Canth. Like a lift.
Like,
with a
not,
TH.
like, when my producer said camp music, I thought we were having a band night. Welcome both.
Thank
Phillip
you.
is a HIV and internist specialist.
Yes.
And do you want to say where you're doing that at?
Like where my office
Yeah,
is?
yeah. Like, do you have a name of your office?
Yes, my office is called Phillip Musikanth MD Inc.
MDE. There you go.
And I'm on Olympic Boulevard near Fairfax.
Near Fairfax. And Heather, you are an attorney specializing in the healthcare field.
Suing insurance companies.
Suing insurance companies. Well, we've got a lot of questions for you tonight. Heather McKeon, this is your third time on the show. She appeared in Michael Moore's show, movie Sicko, and we're going to roll that clip real quick so you can all just get an introduction of Heather and what she did in Sicko. Roll the clip.
Go.
This is Tarsha Harris. Blue Cross didn't deny her treatment and actually approved her operation. But then they discovered that in the distant past, she had a yeast infection.
Apparently it's common. Men, women can get a yeast infection. So was prescribed the yeast infection cream, general cream, and it went away.
She later applied for health insurance, and that's what you're supposed to be disclosing. Serious ailments. The yeast infection was independent and it's not a serious ailment. There was nothing else she could have done. It wasn't until they were going to have to spend money that they looked. If they'd taken 5 minutes beforehand and wanted to clear up the yeast infection, they could have looked at her medical records, they could have talked to her doctor.
Because of the undisclosed yeast infection, Blue Cross dropped Tarsha Harris.
She thinks she's put this behind her. And then Blue Cross changes their mind, tells the doctors, we're taking the money back, go get the money from Tarsha.
The fact of the matter is, it was a yeast infection. That's all it was. I'm still a little bitter because I don't trust insurance companies now. To me, it seems they're always going to be looking for a way out. You know, what happened to helping the person that's sick? Don't make their problems worse.
Hey! Heather, what year was that?
2007.
2007. And Mr. Moore, how did he find you?
So I was on a PBS TV show with my client, talking about the same issues.
The same client that we just saw here.
Yes, and he decided he wanted someone after he'd finished the film that didn't die.
That didn't die. What a novel idea.
So my client, although was rejected for the same reasons other people were, she didn't have a serious of issue. She only had a $7,000 surgery, not failure to pay a liver transplant or something. So he wanted to show that it could happen to anyone. You didn't have to have
Right.
a life-threatening illness.
And did it help you a lot as far as your career goes, or
A little bit, yeah.
a little bit? Yeah. You know,
I went.
it's
yeah.
show business. Roll with it, right?
Right.
Yeah. Well, I have to say, I put out on the web that you guys were coming on the show, and I got over 100 questions, which we'll never get to all of them. But I've picked out some questions that I think are the most important, and we're gonna get right to them. Okay. So, the first one is for Philip. Philip Musikanth. Thank you for coming, Philip.
Thank you for having me.
You're so welcome. Okay, here. Philip, do you think HIV will ever be cured? It seems like the drug companies are more interested in keeping you on the drugs than actually finding a cure for this. This is entitled Wondering in Wyoming. My show does go out to the web, so I got viewers all over the country. That's a really good question.
So,
do you think HIV will ever be cured?
So the short answer is yes, I do. So you know that the pharmaceutical companies want you to stay on the drugs. Speaks to the conspiracy theory that there's some kind of conspiracy to keep people sick, so they
I
can
think
stay
there's
on
a
drugs.
conspiracy thery with everything.
Yeah, there is.
You know, from
That's why I'm saying.
JFK to
Exactly.
your milk duds.
Yeah, to 9/11, really.
Yeah,
Everything.
I saw that on Discovery Channel.
Yes.
So
I do think that it will be cured. You know, at HIV conferences these days, it's part of the agenda. Sometimes is the cure.
how often are those HIV conferences?
Well, I mean, there are HIV conferences all the time. So
As a doctor and an internist, are you required to go?
yes, as a practicing physician, you're required to have at least 24 hours a year of continuing medical education.
I'm writing this down.
And
So-
so I mean, there are different ways of doing it, but conferences are one way.
So you think? Okay. Long story short, you think it's going to be cured?
I do,
Oh,
and
that's good.
and the pharmaceutical companies are working on ways to cure it. Interestingly
like
enough.
malaria.
Yeah, because there's big money in that for them too. My personal feeling is that the cure will not come from pharmaceuticals. I think that
Will it
the
come from
cure
beets?
will that the cure will come when we find a way to manipulate the immune system. So today already there is one person in the world that has been cured. He's commonly referred to as the Berlin patient.
Oh, right.
He had a bone marrow transplant because he had leukemia.
I think I saw an article like 2 years
Yeah.
or 3 years ago about that.
So his bone marrow that they gave him was with a well-documented mutation called the CCR5 delta 32 mutation, and basically the cells do not have on the surface of them receptors for HIV to attach to. HIV is a parasite, it has to get into the cell. So basically HIV burnt out. So that is the one person that is documented.
Yay! We're making some progress here.
We are. So
Despite
that's
it all,
like
people want to see us live because this is basically considered. Remember, it was called the gay cancer,
yeah.
and
So that opened the door for lots of research, and you know the FDA just approved last month the first human trials with stem cells, because it looks like you can afford a functional cure for up to 3 years with stem cells, and you know I think that that's kind of where we're going to find the cure ultimately.
good answer. I'm going to move along here because we got Heather.
Yes.
How are you?
Good.
How are you, Bubba? Nice to see you again. Heather did the show with me live a couple times with
I
me.
did?
Yeah. Heather, here we go. This question. I'm a minimum wage worker. I've never had insurance but was able to get a policy for very little money. Recently I had to go to the doctor and required an outpatient procedure. I received a huge bill. Can you imagine that? A huge bill. When I inquired, they said my deductible had not been met yet. If I could afford insurance before, what good is having it if I cannot pay the medical bill? What is happening? Signed, Anonymous.
I don't know what the procedure was. If it was a life-threatening...
That person
Yeah.
didn't say.
If it's a life-threatening procedure, that you can get whether you have insurance or not. An emergency room will take you under any emergency situation. Most health insurance policies today, especially the ones that come under Covered California, which would be the Affordable Care Act,
ACA.
or
Affordable
Obamacare,
Care,
if you want.
Obamacare, whatever you want to call it, right?
have really high deductibles. on anything that's not preventative medicine. So in other words, you can go once a year for your checkup. Your kids can get vaccinated. You can have your mammogram. Those kinds of things are now fully covered. But in response to anything that's outside the very normal preventative care or just standard care, it gets very expensive.
So if this person would have said what their actual procedure was, you would have been able to give them a little bit more specific answer.
Right, but generally speaking, covered California policies don't cover anything that's outside the preventative or very, very ill.
Enough with that question. Next question is directed for Dr. Phillip Musikanth. And Phillip, I'll let you read it just so people don't think I'm making this stuff up.
Does PrEP really work in preventing me from getting HIV?
Okay, let's talk about first thing. What is PrEP?
All right. So PrEP is pre-exposure prophylaxis.
Pre-exposure
Prophylaxis for HIV.
like a condom?
Exactly, because a condom
prophylactic?
yeah, it
I learned
prevents you
about
from
in
getting
health class in the
pregnant.
7th grade. You want to know what year that was? I think I laughed and got smacked by my gym teacher. He taught health as well. Okay, I'm sorry, I didn't mean to interrupt, but go ahead. Prophylactic got me all excited.
Those gym teachers.
Those gym teachers, they were really horny devils. All right, okay, let's go on with that.
All right.
PrEP is.
So, to finish the question, it says, if it does work, why doesn't it cure HIV in people already infected?
Good question.
Yeah. So
Why is that?
Well, because PrEP prevents infection, and curing infection is
PrEP prevents infection.
Yes.
Okay. And
cure is a completely different thing.
Animal.
Yes. So, does PrEP really work in preventing me from getting HIV? So there are a lot of studies that have been done looking at this, and there are various, results depending on the study. But on average, it's about 92% effective
That's
at
very high
preventing.
percentage.
Yeah, no, it is.
It's better than a condom.
I don't know, actually.
The vow of chastity will break long before a condom. Right?
Yeah, this is true.
That is true, right?
One would hope.
You can preach condoms all you want, but the vow of chastity break long before a condom. Oh, that's
Yes.
good. We're going to move on. Anything else you wanted to add to the PrEP? If I came to you, and I think there might even be a question. If I came to you and said I want to go on it, would you try to talk me out of it, or would you actually seek counseling or anything about that, or would you just write a script for it and here you go?
Well, I would counsel you, and counseling is very important when you put somebody on PrEP.
I think that's true. I think that's very important. Yeah.
So, the recommendation is that anybody who's at risk of getting HIV should consider being on PrEP. And, there are various people that are at risk. It depends on a number of factors.
Let's just be blunt here. If you're going to be out and about,
yes,
and if you would engage in, or think you're going to engage in unprotected sex, you should, and especially if you're a gay male, and not leaving females out at all, you should really consider this.
Absolutely.
But shouldn't it be in conjunction with protected sex?
And that's the caveat.
That's
the
the caveat.
recommendation is that when you're taking PrEP, you still have safe sex. You still use condoms.
Thank you, Phillip. Moving on. Next question. Heather, I'll let you read this one. It doesn't say who this is for, but this one is outraged on Ogden. I'll let Heather read it. And wait, Phillip, take it and toss it over there on the floor. There you go. Yeah, all right, let's go, baby. Heather, you're on.
I am a 50-year-old female who is HIV positive and have had the chickenpox. Shingles runs in my family. My doctor recommended I get a shingles shot. I was denied by my insurance company because they said it is recommended after you turn 60. My doctor requested an override because of my HIV status and family history. The request was again denied. Is there any way for me to get preventative care through my insurance?
Is that a good question?
That's a good question, and probably
Take it and toss it.
Probably
there you go.
not in this,
we tossed. There you go. All right, what's up with that?
probably not in this situation because preventative care is sort of decided by the CDC, the Centers for Disease, and the National Institute for Health, and once they decide that you're not supposed to get a shingles shot until you're 60, the insurance companies can rely on that. There's been a lot of talk about shingles because more and more people are getting them below
I've had friends that
under
had
60,
it
yeah.
that were just about 50.
So I think the recommendation's going to get lowered, but until it does that, the insurance company can kind of rely on it. Now, it's odd that usually when you have some reason why it could affect you more outside the realm, such as her HIV history, that the carrier would still deny it. But it's such a shingles shots aren't all that expensive. It's just not something anyone's going to take up to fight for.
I have to honestly say, I asked to get it because it does run in my family. I have never had shingles, but I went to get it and it was denied. I paid for it for myself,
Right.
just as smart thinking preventative, because
Well, that's what my husband, my husband's a teacher, and when all those measles were running around, he decided he better get a
With young
measles shot.
children, so
yeah,
yeah,
so he
right.
figured he better get a measles shot because the parents weren't necessarily getting measles shots. And our insurance company wouldn't pay for it. It's sort of the same thing because he was outside the realm of supposed to be getting it, and we just decided it was worth the money to.
It's their
Just in
out.
case.
Why did they deny it? Because they can.
Exactly.
because they
That's
can.
the
And
answer. Because they can. There's no good medical reason to deny it. They do it
Well,
because they can.
It's like, well, isn't it better to prevent it than to have the person get it? Well, with shingles, I understand once you get it, you can't do nothing with it. Correct, Philip? Live with it until the outbreak subsides. Correct.
Well, there's medication. You can take medication, which helps to abate it. But I mean, it can still be pretty nasty, painful,
you
prolonged.
can get it in your eye, right?
Yes.
In your eye, you can go blind. You can get it anywhere.
That's scary business. That's very
Oh,
scary
yeah.
business. All right.
And you can have pain for a long time after it's gone too.
The pain is what I hear is the most. So
Mhm.
anyhow, my mother had it for 2 years before she passed on, and she said the pain was unbelievable. Let's move on. This is for Philip and Heather. Philip, why don't you read this question, please?
I am 26 and HIV negative and very healthy. My doctor prescribed drugs for PrEP, which insurance denied. Do I have any legal recourse?
That is a good question.
That is a good question.
So, from my experience, most insurance companies are covering PrEP. But clearly, from the question, there are insurance companies that still choose
I've
to
heard
deny
it. There's some that are just not doing it. Heather, have this going to come across your palate before?
It has not, but it's sort of
There you
the
go.
opposite of what we just talked about with the shingles. Because my understanding from Dr. Phillip here is the CDC does recommend PrEP at this point.
Yes.
So so you have a little further to go with legal recourse.
If someone was to call you with that question and just exactly that, what would you help them? What would you tell them?
Well, the first thing I'd want to do is see their policy.
I don't mean that that's funny, but yeah. You
Yeah.
got to see what's in between. You got to read between the lines, within
Right.
the fine print, right?
And see if there's somewhere in there where it talks about preventive care or preventive care recommended by the CDC. You'd be surprised what gems you can find actually in the policy that they think are protecting them on the shingle shot, but you might be able to use against them on this end.
Would you, if you saw clearly in fine print that they could get around this, would you be able to defend them as a representative and say, this is why I think you should do this for my client, and would you represent them?
Yes, I would.
You would.
And the other thing is, I think it's an important public health issue. And if I knew of someone who really was concerned and really wanted to stand up, because these are hard questions because the person has to admit that they're HIV positive, or HIV negative, but that they're gay and they're maybe promiscuous or
No,
just.
But don't you think that
not
falls in line with
necessarily-
birth control?
Right.
Hi, I want birth control. Wasn't that basically saying, I hate to use this word, but with Sandra Fluke, hi,
Oh.
all right, with Rush Limbaugh, she's a slut. Okay, because she wants birth control. Oh, hi, I'm a male whore. I was at a
Right.
club once that said, a guy had a T-shirt on and it said Truvada whore. Gay people are a little
Yeah.
bit out there with
I don't
things
think
head
it-
on.
Yeah, I don't think it points to any of that. But
I
there is,
agree, it
but
does
there is
not.
a stigma on there. So someone has to be willing to accept that stigma. If someone, like some crazy person's calling them a male slut or whatever, to stand up for the rights, because I think it's something that you could definitely bring public attention to, both in in state legislatures and stuff, because they do care about public health issue.
Philip, as a doctor, have you had many young patients come to you and say, I want to start PrEP?
Oh, I put people on PrEP every week.
Every week.
Every week I have people coming in to go on PrEP.
Do you look at
And-
them any differently
I
when they
know.
ask
I
you?
mean,
Or are you just
not
saying
at all.
they're being very sensible and common
Oh,
because it's
yeah.
better than to It's like being pregnant.
It's the same thing you said. It's about birth control, right? It shouldn't be embarrassing for a woman to be on birth control, but there is some stigma, and
Of course,
some
there's
people,
always stigma.
right?
Heather.
So
there's always stigma.
the person
The scarlet letter lives on.
Right.
Right.
So the person has to be willing to put their records out there, and I think that's actually one of these questions about who knows what and when do they know it.
Who knows what and when did they know it? All right. Well, that's.
And, I just want to clarify that it's not that people going on PrEP are promiscuous. And that's one of the arguments out there that people are throwing around. It's not necessarily that. It's an added layer of protection. And it's a good public health strategy because...
Like a double condom.
I would use it. I would use it in the
completely.
same argument with now the vaccine for HPV that they
Yes.
now got past it as young as 12-year-old
HPV
girls.
is a ladies thing.
Right.
No, it's not.
It's genital
It's
warts.
men's thing
that's
too.
general.
But there's a vaccine for it that they can give to 12-year-old girls, and whether or not you should give a 12-year, are we telling the girls to be sexually active?
Yeah.
Of course not. It's just
It's protecting
Protection
them
for
for
later
when
on.
they become sexually active, which hopefully at some point they will.
Moving on. Thank you. Here's a good question. This came in last minute. I saw an article on the news where certain insurance companies are allowing patients to do doctor visits via the web. Is this a good idea?
For me, I think it's an excellent idea.
So does that give you more coffee breaks or what?
No,
Let's
because
here.
I do a lot of stuff virtually, by telephone, by email, and that's all just work that I just do, so which I typically do not get reimbursed for. So I think that we're moving into an age where things are virtual, and there's no reason not to do that.
What about the fact, would there be a point where if someone is talking to you via the web, and would there be a point where you say, I think you really need to come in, I can't make a proper diagnosis by
Yes.
looking at this?
Yes.
And you would know the fine line between that.
Yes.
Of pass, don't pass.
Oh yeah, completely. Because it's
Versus
like,
then I just need a prescription for an antibiotic. And,
well, yeah, because there's some things you can address on a telephone conversation without even seeing anything. But like a rash is a very difficult thing
Does
to
it
do.
depend where the rash is?
Any rash is hard to diagnose
Nice.
looking at a picture. You really want to see it in the flesh.
Yeah, that is. So it's a way of cutting down on backing up the waiting room for something that could be handled.
Yeah.
And
It's a convenience thing for patients too, because they don't have to go to an appointment.
Yeah.
And they can do it from home on the computer.
So the answer to that is that's a good idea.
I think it's
That's
a good idea.
Heather, this question's for you. We'll let you read it.
On several occasions, my health insurance company has denied drug treatment for me, even though my doctor has diagnosed an issue and written a prescription. Since when did health insurance companies determine diagnosis and treatments? Well, they do every day. I mean,
How do you deal with this though? What do you like?
well, it all depends on what the drug. This is kind of
toss the question.
yeah, toss the question. That's a hard one because it could be that they prescribed this drug when really you should be taking this drug over here because this one is a generic and this is the name brand and it's $1,000 difference. That could be one reason they deny it. They could deny it because your condition, the normal treatment is X drug, and your doctor wants to try something new because they had some
Right.
success and they want Y drug. Carriers don't have to cover, what's the word?
Carriers don't have to cover that coverage.
Off-label.
Off-label
Off-label,
use,
right.
experimental. That's the word I was thinking of. So
Where does the line? Where do you know? How does a person know when someone is being denied this, where they need to step up to the plate and call their insurance and say, "I'm going to sue you"?
you should always ask the pharmacist: is it this drug that they're denying, or is it this type of drug? In other words, is it just they don't like this name brand, they want me to take this brand, and it does the same thing, and then you should take your own health care into your own hands and call your doctor and say, my insurance company wants to move me from drug X to drug Y. Is drug Y going to be just as effective as drug X
B.
because of my own condition? And 9 out of 10 times the doctor will be like, sure, that was just the last name I remember seeing, because because the patient right before you had a different insurance company and they wanted drug X, not drug Y. So sometimes it's a completely easy thing to fix if you're proactive about your own health care.
And I think that what you're trying to say is you have to be your own advocate here.
You do.
And
Because
Phillip, is there a difference? I saw an article, I think it was in Consumer Reports, and it was like 6 months ago, where they did a study where somebody was using generic drugs, and it was not as efficient as a brand name drug, and because the way it broke down in the body, and the patients were getting sick using the generic, where they went on the brand name, and they were well. Is this a common thing that's coming up with you? Are you finding this?
I wouldn't say it's a common thing, because we use generics all the time. We're forced to, because they're less expensive. But certainly some generics are not as effective as brand drugs, especially some of the antidepressants.
What would that be your number one generic drug? Would be an antidepressant?
No, just about every drug has. I mean, they're generics for just about everything. When drugs lose their patent, they become generic.
How often? When do they lose a patent?
Usually after 17 years.
Really? So then the patent's over and everyone.
And then there's generics. So
kind of like a book is 50
but
years.
some generics are not as effective. It's like anything, like buying a no-name brand product in the supermarket.
Are they playing with fire though? If somebody's using that and now all of a sudden say they're HIV positive and now their drug has become generic, but now it's not working, and that patient should get sick and could possibly lose their life over this?
Well, the pretext is that generics have to meet certain efficacy requirements. They have to be almost as efficacious as the brand. I think the number is 70 or 80% as effective as the brand.
But there are cases it doesn't work.
Yeah, but as long as it's doing that, they're not playing with fire.
So once again, it's being your own advocate, being aware of what's going on in your body, and reporting back to your doctor if you think this is not working right.
Yeah, because sometimes it doesn't, and sometimes people have more side effects from a generic. They can have a reaction to a generic because the base that's being used in the drug may be a little different than.
So if they notice something, they should speak up right away.
Yeah, absolutely.
They should definitely speak up.
Definitely.
And is there a way to make the insurance company go back to the brand name? Could you, as a doctor, can you say, hey, this isn't working for that patient, and this patient really needs to go back to the brand name of this drug?
Especially if there's any allergic reaction. Like what you were saying about the base of this drug may not. That's something I can do on a regular basis. I do on a regular basis.
It's great. You know what? This show is out of time. And we're going to come back for show 2. And thank you. Come back. Can you guys stay for part 2?
Yes.
All right. Wave goodbye. Thank you, Bye. West Hollywood. God bless. Mwah. Mwah. We'll see you. Stay tuned. Good night, West Hollywood. Wow. Anybody need a bathroom break?
Can I have this water? I'm
No,
gonna
you
cough.
can't.